Hi, I'm Sharon Rona, and I'm a nurse practitioner, and I work in Columbus, Ohio. I have the privilege to work with children and young adults with both acute pain and chronic pain. In Ohio, we have taken a lot of initiatives to try to give guidelines for prescribing medications and therapies for pain management. At my institution that I work with, we certainly focus on a multimodal analgesia, which includes not only medications, but also non-medications to treat pain in children and adolescents. Some of the children that we work with certainly will require the use of stronger pain medications such as opioids. When that's required, we really do a lot of screening with our patients and families. We want to identify if there are any risk. We want to talk with the families about what risk it is with prescribing opioids and if their children taking the opioids. We certainly talk about function, and our goal is always to improve function in our patients, not necessarily to improve pain, but hopefully both of those will occur. In our patients, when we do prescribe opioids or any medications, we certainly talk about locking up your medications and how important that is to keep our children and our community safe. We also talk about when they're finished with their medications, what do they do with those unused medications, and how they need to properly dispose of them so it keeps our community safe. So there are new guidelines out here in the state of Ohio for acute prescribing and pain management, guidelines for the emergency department, and then guidelines for chronic pain, which are really going to significantly impact our community. One of the things that we really need to look at is our state getting our insurance companies to approve and pay for other modalities more than medications, such as acupuncture, massage therapy, psychology, to teach these kids biofeedback and ways that they can manage their pain. We also need to work with our insurance companies to make sure that we can provide lock boxes for families. If we're teaching our families to lock up medications in order to keep their family and community safe, we need to have the means for these families to be able to provide that type of resource. That is what I'd recommend.